My name is Matt Gopal. I'm a veterinary surgeon and I work for SageTech Veterinary. I got involved with SageTech Veterinary way back in 2016, and it was through a friend of mine, a human anaesthetist, that rang me up one day while I was in consultations and said, "Matt, would it be okay if I came down to your surgery and tried to capture some of your waste anaesthetics?" And I said, "Yep, that's absolutely fine, that's no problem at all." But the big question for me was, why on earth would you want to do that? And that's where my journey with recognizing the significant impact that these volatile agents have on the environment began. So the use of anaesthetic agents makes up a significant proportion of the carbon footprint of a veterinary practice. In fact, if you look at the combined Scope 1 and Scope 2 emissions, 15 to 20% of that figure is solely down to anaesthetic volatile agents. The use of these volatile agents is essentially the backbone of veterinary anaesthesia, and the majority of our patients in general practice will be anaesthetised using a volatile agent. So the solution to this problem that SageTech Veterinary have developed is this here. This is the SageTech Veterinary Vet Dock and the Vet Can. The Vet Dock accepts waste gases that come from the waste hose of the breathing circuit. The gases come through the Vet Dock, they then pass through the Vet Can, and inside this Vet Can there is a specific media that binds the volatile agent to it, and then at a later date when these canisters are full, the volatile can then be extracted from these Vet Cans, and that extracted material can then be purified and reused clinically. This is creating a circular economy. So, were a practice to install a Vet Dock next to their anaesthetic workstation and use Vet Cans to absorb the waste anaesthetic agent that is coming through from the patient, they would be significantly decreasing their carbon footprint. And they're doing that by preventing the direct release into the environment of their waste anaesthetic gases, which is commonplace throughout the profession. Not only are we decreasing the footprint by preventing the release of these drugs directly into the environment where they have their significant environmental effect, we are also decreasing the carbon footprint of drug manufacture by the very fact that we are reusing the agent that is captured within these Vet Cans. With the climate emergency ever present, maybe this is the time that your practice wants to stand up to be counted and to take responsibility over the emissions that you create through waste volatile anaesthetic agents. The SageTech solution is cost effective, it's simple to use, it integrates very simply into the normal workflow and is available right now. So if you'd like to know more about our system and look at installing it at your practice, please feel free to get in touch via our website.